we're in big trouble. I know you know this, but the only words that really reverberate in my head are trouble, trouble, trouble. Why are we in trouble? One, we've got the first wave of coronavirus patients coming through. That's a massive amount of trouble. It's killing our economy. It's killing our people. The second wave is an unexpected wave. And again, it'll be the wave that politicians didn't foresee. It'll be the wave that hospital administrators didn't foresee. It'll be the wave that America at large didn't foresee. But private practice doctors foresaw it. Private practice clinicians foresaw it. People like me who've been in the healthcare business for a long time see it, clear as day. And that is the 4.5 to 5 million elective cases that are piling up. See, when you talk to an elected official and you ask them, what's an elective case? They'll say it's a boob job. Well, it's not a boob job. Elective cases are all medical cases that are not an emergency case. The trouble is when you put off elective cases, kidney stones, radiation, dialysis, colonoscopies, something much more devious comes later. People will say things like, well, total joints don't matter. Well, one, do you even know what a total joint is? And if you do, then you know that if someone needs a hip replacement, that it does matter. Now, here's the silver lining. The silver lining is if physicians ever wanted to have stewardship, ownership of healthcare ever again, they would make sure that these cases only go to physician-owned surgical centers and surgical hospitals. When clinically appropriate, of course. Some of you will email me and say, but it's not clinically appropriate, because you're idiots. We have 4.5 million cases stacked up. How are we going to do them? You going to send patients to a hospital right now? You really? The infection rates are already high. Readmission rates are already through the roof. Are you really going to send healthy, working patients to those kinds of places? Now, the health systems will fight day and night. They want those cases, and they want them bad. They want that money. But it will be the worst decision you ever make. If you are in control of patients, i.e. you're a consultant, you're an advisor, you're a physician, the right place to send those cases is private practice, ambulatory surgery center locations, and surgical hospitals owned by physicians. Let's be honest, none of this would have happened. The virus would have happened, but we would have been much more prepared had physicians been in charge. Now, we can talk about the reasons that physicians are not in charge. Some of it's their fault. It really is. They're highly competitive. They don't like working together really well. They need some introspection. They generally think they're the smartest beings on the planet. The other issue is legislation. There are 3 pieces of legislation, which I've talked about numerous times, that have also led to this perfect storm. First one, 1997 Balanced Budget Act, and it capped the number of residents. Well, if you don't have enough residents, then you don't have enough doctors. Seems fair. The second piece of legislation, Certificate of Need. Certificate of Need is alive and well in 35 states. Thankfully, North Carolina just temporarily suspended theirs. For those of you not familiar with the con laws, they state that if you want to build another hospital, surgery center, or any type of medical facility, you have to get the permission of a group. Generally, the group or committee, con committee, is put together by the hospital owners, the health insurance carriers, and whoever owns the land that the hospitals sit on. And so they don't want competition. And so if you go before them and you say, I'd love to build a hospital in the middle of Manhattan, they will tell you to go kiss yourself. It won't happen. If you say, I want to really build a new radiology center in North Carolina, and I think I can use it to treat lower income patients, guess what will happen? The answer is no. Altria doesn't like that. They don't want any competition. They don't like you. They just want you to pay a significantly higher dollar amount. They don't want you to pay less. Remember, we have to increase premiums to increase revenues. If we increase revenues, our stock price goes up. This is how the world works. It doesn't make people nefarious. You just have to know what their position is. And my position is physician-administrated, physician-owned healthcare is a much better world. A much better world than insurance companies, pension funds, and private equity owning hospitals. This debacle that we're in today is largely because of these con laws. Now, the last piece of legislation, the wonderful ACA, look, you can agree or disagree with the ACA, but there's a provision in it that has absolutely decimated the United States healthcare. And that's the provision that made it illegal for physicians to own hospitals. Imagine being a chef and they tell you you can't own a restaurant. You might self-refer patients. Imagine being a owner of a car dealership and you can't bring in your own referrals. Now, the reason it was done is because the American people at large are jealous of people that make more money than them. And politicians are extremely jealous. Oh, that physician makes more money than me. I really hate that person. I really do. Inside my own guts, I hate them because they make more money than me. Now, what they'll tell you is that, well, doctors like to refer to their country club friends. Maybe that's true. Maybe it's not. Maybe I don't care. So what happened as a result of removing physician ownership from hospitals is private equity bought in. Insurance carriers bought in. This is the exact problem with healthcare. Now, before you freaky communists come on and start telling me that profits are bad, please don't do that. I like profits. I like profits a lot because profits mean there's an opportunity to compete, and competition leads to lower prices and higher quality outcomes. And if there's anything I want in healthcare, I want to promote lower prices. I want to promote higher quality outcomes. And how do we get those two? Private practice physicians, ambulatory surgery centers, surgical hospitals, physician-owned radiology centers and independent radiology centers. That's how we get them. We see it every day with our customers. They pay 40 to 50% less for 80% of what they use. How do I know? It's data. How do I see it? I see private practice physicians and private practice physician groups calling us every single day saying, oh, happy to help. Yep, my costs are X, my price is Y. And their Y price is 50 to 60% lower than the carrier's price. So, what are the three things that we've talked about today? One is the impending tsunami of elective cases. What are we going to do with them? It's best to turn them over to physician-owned facilities such as ambulatory surgery centers and surgical hospitals. If you're a broker, consultant, advisor, it's best to have bundled contracts with private practice doctors, period. The second thing, how do we return healthcare back to the rightful owners? The people who should have had it all along, the people who should have had a better conscience, the people who should have done the right thing. Physicians, if you want to re-own healthcare, if you want to be in charge, then be in charge, then lead the way. Do the right things. If you let these health systems and large hospitals that work extremely well with carriers, if you let them have this tsunami of elective cases, you will have lost your opportunity. You'll have lost your chance. You have lost the biggest opportunity to lower the price of healthcare to increase quality. And finally, the third thing we talked about is all this legislation that has hurt our country. From certificate of need laws to capping the number of physicians, and finally to, well, shit, I forgot. It doesn't matter. What matters is that, the ACA. What matters is that we've got to take back healthcare. And the right way to do it is through private practice doctors fantastic clinicians and working directly with employers and making sure that the carriers and big hospitals and government are gone. They're the reason that this crazy virus has gotten as far as it is. Perhaps we're also to blame. We'll see. Now, don't forget, this is unedited, fastly recorded, because we're trying to get the content out. So if we've said something incorrectly or, I didn't speak English perfectly, well, chalk it up to English being my second language. Dutch Rojas out.